Commissioner, good afternoon. It's actually Saturday, June 20th. We were going to do the video a little bit earlier this week, not on our typical Sunday. So how are you?
I'm good, Ken. How about you?
I'm good, thank you. I'm good. We had a really busy week at the department. A lot of things happening, lots of communication, and I think it's really important. We started a discussion today with Juneteenth, which we celebrated across the country yesterday. Really the celebration of historic moments, and I think you wanted to touch on that right away in the message to all of our staff.
So yeah, for Juneteenth, for me, it has been the acknowledgement of just the end of slavery in America. And, most of the time that people, most of the information that people knew about Juneteenth usually came through African Americans who understood its origins. It was actually kind of 2 years after the Emancipation
Yep.
Proclamation that that date kind of was a line of demarcation in the history of this country. For me, it's a line of demarcation because it's also my wedding anniversary. And, that was a purposeful choice for us to never forget. And I think this year, Juneteenth took on a different meaning. It was less celebratory and more of a call to action, more of an opportunity to share information across races, across the country, to say, as Black people in America, we have been kind of saying what our truth is for years and years and years and generations, and finally people are listening. So for us at the department, it's an important time of our lives to be able to say, where do we fit in on all of that? Because at the end of the day, we are an institution that interacts with communities and with families. And, there comes a point at which we become complicit with a lot of the disparities and outcomes for particularly kids and families of color. The Black Lives Matter movement is a call to action to say that, of course, all lives matter. But when you recognize that Black lives matter, you recognize that you have to challenge when there are things that create outcomes that are disparate for Black and brown families. And for child protection, we have to be truthful about that and what that means about, how we do our work. I've grown up in DCF. I know who we are from the inside out. And I also know that we have a lot of work to do. We can't continue the way we are. And we have to, reckon with the history of our country and the history of child protection as it relates to race. I've been doing a lot of media presentations over the year that I've been in this role. And, about a month or so ago, I did an interview on YBC with Juan Castillo. And we were just talking about the issue of how DCF interacts with communities of color. And, one of the things that I think struck me as I thought about how do you lead a department that has some vestiges of those institutional racist barriers that impact kids and families that we work with. And click on the comment section of that, Ken, so I can just share that as part of, where my mind as the leader of this department comes from.
Yep, hold on. We're having a little trouble here. Let's see.
So, when we did this interview at the same time, of course, people comment in the comment box. And what I wanted to share with folks is, one of the comments that I hear pretty regularly when I talk about, respect and, the values that we have within the department, and that, the type of leader that I believe I need to be in order to lead this department. And, I thought it was striking and something that it was important to share with people that, sometimes communities view us through this lens by which they receive us. And, the one that really struck me is the not all DCF workers carry your values, and the values that we talk about in terms of how we do this work. And, it talks about how we engage with communities and how we interact with families of color. And a lot of times, we don't recognize how hard it is to have our staff knock on someone's door and what that feels like for the person on the other side. And so, as the week started to roll on, we recognized that as a department, although we have been trying, for the last decade or so to really be highlighting and elevating our racial justice work, we haven't moved the needle. And it's important for us to say, stop, figure this out, because kids and families need us to get this right. Our workforce needs us to get this right. So as leaders, it was my job probably about a week or so ago to say, we have to develop a framework that helps people understand that there are conditions within communities that have been created over the years by institutional oppression, legalized discrimination that has rendered certain communities that we work with in conditions that we see today. So it was important for us to develop a framework so that leaders can talk about being anti-racist, which is different than saying, I don't carry or espouse racist values. It's really taking a position that we in the department will no longer stand for people to be treated in a way that does not reflect who we are and what we value, and that the overall arching mission of the department is to, redesign who we are, to have an anti-racist strategy, to think about, our policies, our practice, our norms, our values. Shifting our practices for outcomes in kids and families has to come through that anti-racist lens. And, for us to move in the right direction and stay moving in that direction, equity has to move towards justice. And I think we're in a moment in this country's history that we can speak truth to power, and that, as a department, this has to be in the context of a framework that everybody can deliver its message. We've been getting so much feedback from across the department that some conversations have gone really well and some forums have gone really, really well, and that some have not. And so we decided that we were going to pause for a week to get our act together as a leadership group to say, what's the framework that we're going to help lead the department into this next important phase of how DCF can be received by our communities, but more importantly, feel like a place that our staff want to work and want to contribute to the development of kids and families and their stability. So more to come on that. We've been teasing this up and teeing it up, but finally the framework has come together, and folks will start to hear their leaders talk in that context of the framework you just put on the screen. So I'm excited that we are at that place in the department's history. It's been a long time coming.
Long time. So more information to come. And certainly we wanted to give staff just a little glimpse of all of the extensive work that's gone into creating that framework. Now, this weekend is Father's Day, which is also celebrating within the month of June, which is actually Reunification Month as well. So I think you wanted to talk about how those two pieces were connected as well.
Yeah, I'm a daddy's girl, admitted daddy's girl. I lost my dad several years ago, so I recognize the importance of dads and father figures in kids' lives. So in this month's Spotlight on What's Right, we highlight several articles about reunification, and two of them are about dads. So it's important, if you haven't seen that yet, to go and check out this month's Spotlight. It's also a reminder to us that we are into DCF's phase 1 of increasing parent and child visitation triage, which is a process that says we prefer still virtual visits as we understand the development and the evolution of the COVID virus and transmission in Connecticut, but we recognize that we need to move a little bit closer to allowing a discussion about in-person visitation between parents and kids for that certain cohorts of kids. And it was kids under the age of 6 months old, kids that are within 3 months of reunification, kids in congregate settings congregate settings of SOLNA and in the communities are developing their own visitation protocols. And then in places where virtual contact between parents and kids have been spotty or not happening at all, we give that as the kind of the initial guideline of cases that we can talk about doing some form of in-person visitation. It's our toe in the water. We're proceeding very, very cautiously and slowly, but we recognize that that's an important step towards reunification when you get kids and their parents to continue to maintain contact with each other.
And in the metaphor, the toe in the water, really what we're balancing with the department is inching closer to resuming full operations, just like the state of Connecticut is doing. We know during the week we had the commencing of phase 2, where bowling alleys and gyms and amusement parks and restaurants were open. So the department, along with the entire state, are really balancing the public health data what's in children's best interest, how to maintain the safety and welfare of the workforce as well.
Yeah.
Which, Commissioner, I think at this point, typically in the videos, you go over the statistics of COVID-19 positive diagnoses. So I think for those staff who wish not to hear that information, now is a good time for them to jump off.
Yeah, one of the slides you showed before was from our Color of COVID presentation that Dr. Reggie Eady from Trinity Health talked to us about the disparate health outcomes related to kids and families of color. And we can't forget that even in the midst of a racial pandemic, so to speak, a day of reckoning for all of us in society to pay attention to. We are in the midst of a serious physical health care crisis, a serious public health crisis that, by sharing the data on this, we can kind of stay ahead of what our footprint has been on the broader dialogue across Connecticut.
Great.
So the statistics right now reflect that, one of a stark statistic is that 18,000 individual users have logged into our COVID website. That's just remarkable. It tells us about the tremendous need for people wanting to get information. And so what did you tell me? The two biggest categories that people are still clicking our website?
So they still are looking at food resources. In childcare. So that to put into context, over 18,000 people, like you said, have hit the website. That's more people that would fit into the Excel Center in Hartford, which is tremendous. But food and childcare are still absolutely on the forefront of families' minds, whether you're involved with DCF or you're a family in the community not known to us. And that's an important distinction to make. It's who's coming to the site are all types of families.
Yeah, and it's important for us to pay attention to that data because the recovery on the other side of COVID is going to be just tremendous. And we want to make sure that kids and families feel our support versus surveillance. And that's one of the ways that we can stay ahead of what it is that families need by looking at what that those hits to our website are telling us. So as far as other data, we had one new positive foster parent, I think, since last time. So we're up to 65 foster parents positive. We've had 0 new staff positive, which, 34 staff members across the department have tested positive, with 33 of them having come back to work. There's a different testing cadence that's going to be scaled up with testing for staff in our congregate facilities. We are one of 5 state agencies that are going to be doing that on a regular basis. And then lastly, the last data point that we continue to monitor is no new kids have tested positive. So we're holding steady at 15. And so as we continue to understand and unpack how our outcomes need to match our values as an agency, how we really need to have tough conversations and tough action to move us to the next phase of who we are as a DCF and as a service delivery system. We have to understand that we're doing so in the context of just tremendously difficult times. And our staff and our families need us to continue to band together to make that a reality, that somewhere on the other side of COVID, we're all going to be stronger.
Absolutely. Absolutely. So, Commissioner, on behalf of all of us, thank you for your continued leadership, your guidance, and your support. We also hope on this Saturday, which is absolutely gorgeous out, you've taken some time to rest up and spend time with your family as well. So I know we'll all get back in touch very quickly.
Yeah, Ken, thank you so much. I love the position that I'm in right now. And I also recognize that for such a time as this, I am in the right seat at the right time.
Absolutely. Great. Thank you so much. Have a great week.
All right. Take care.